doctor, patient, somebody interested in learning about full mouth rehabilitation. In particular, we talk a lot about implants, and this one in particular, I'm looking at it on these levels here. There's single tooth replacement, and this one is called Great Starter Case. So if you're a dentist out there looking for a beginning case to start off literally your first implant placement, this is a case, and I'll discuss why it is in a second. But let's look at the treatment assessment protocol that I have so we can kind of evaluate the bone here. We have a green on the bone density for the upper, but we have an orange on the lower on bone density. So we'll look at that in a second. That's kind of a split. It's not common that I see such a drastic split on bone density between the upper and lower. Facial bone, bone constriction are all greens. Detached gingiva is a light green because you have a little ridge dip, and ridge height is also light green, but otherwise the sinus bone and the IE nerve are all greens. So that all looks very good. That's why it's a starter case, and it's a very good positioning. If you are a right-handed dentist, this is even better because two of them are on the right side, one is on the left side. You would want to plan out maybe this one and this one first, and then follow up on this side. And I'll explain, this one's a little bit trickier, but let's take a look at the bone a little more closely on our CT. So here we go. Let's look at number 5, which is right here. So I don't know if this was grafted or not grafted, but this tooth has been gone for quite a while. I don't see really any remnant. Maybe this is the original line of where the tooth actually was, but the facial plate was good enough to hold into it, and that we have nice density there. It's a little less dense than I would like, so this is going to be more of a compressive technique when you put the implant in, and you want an implant, at least one that you know that there's a really high quality surface texturing, maybe a aqua based or a very hydrophilic based implant surface texture for here, because you do have lighter bone and you want as many cells and you want as much density and cells to come to this implant sooner than later. And he's got a great ridge here. It doesn't look like it's really dipped much at all here. Your gum line's going to look great. So this is such a winner case. This is all the things you want when you first start a case. You have nice parallel walls here with these other teeth, so you should be able to follow the line angle of these teeth, get them in, get the implant in mesial distally, and then you're looking at a facial lingual position, and with this particular bone is very flat, so it's not hard to kind of find the right position for that. So you would want to use your pins. You do your first osteotomy, you put a pin in and just correct the angulation. This would be very, very easy to correct the angulation on the bone like this. This is not solid bone, and so you can easily manipulate the burr, the drill for that purpose to re-angle that. So let's look. I think I had some implants that I did put in here. Let's see, that's the lower. Here is this one here. This is a nice wide implant. You can go longer. You know, typically longer is fine. You don't have to worry about the length here. The sinus is pretty far away. You don't have any anatomical features. 11.5 will suffice. This one is a, let's see, I can't see with my cursor in the way. Let's see, what type of implant was that again? That one is a 5. So this is a 5 by 11.5. You don't have to do that. You can do a smaller diameter one. Just remember your drill sequence, you only go to maybe a 3.5 if you're putting in a 4.0. If you're going to do a 4.2 or 4.5, you don't go anything bigger than that 4 or 3.7 type size. Use a different burr to kind of get that. I have different burrs that can allow you to make the osteotomy just, you know, a couple hundredths of a millimeter difference in diameter, and sometimes you do want to tailor the osteotomy for a specific compression. So from a starter point of view, follow your kit. Dental implant kits always have a recommendation for hard bone and soft bone. Clearly follow the soft bone in all of these cases here. So that's how the number 5 looks like. So let's look at the bottom one here. I put an implant in there. That one looks a little bit more narrow. And get rid of some of these measurements here. Let's look at that. Go back to the implant, and we can just zero in on that implant here. So this is what it looks like here. This is denser, so use your regular drill sequence here. Fairly homogeneous type of bone here. Very good bone. Heavier than, this is a pretty typical scenario where the ridge on the bottom is much harder, or looks much harder than the upper. Looks like they might have done some sort of graft here, and you can kind of see the remnant of how that looked like. I'm not really clear. Patient doesn't remember, but you can also see that remnant here more closely where it's a little more dense, and so that has to do with the graft material that was put in there on that one, and wasn't really, it was integrated, it wasn't fully like resorbed away. So that's a good sign that there's some good healing there. And the implant you can put in here, the nerve is way down here. It's actually not even in my CT view. It's way at the bottom. It's right down somewhere in here. You can put in something like this length here. This is adequate. And the diameter is adequate. So let's see which size. It's going to block again. I think that's a 5. Also a 5 by 11.5. So you're going to get very good stability no matter what you do in this case. It's pretty straightforward. You got a nice, I would follow this premolar and make sure you just have the right trajectory here. Or you can do a simple measurement from the distal part here to the center of the implant, and now you know how far your implant should start from the distal portion here. And to double check, you can also take that and put it here and go, okay, well, is that even? Well, it didn't look that even, so maybe you move this a little bit more over, you know, to where you think it should be. So let's say you go about 4 millimeters on one side, 4 millimeters on the other. That's where you start your drill sequence, and that's the mesial distal direction. And the facial or the buccal lingual direction, you're going to follow this buccal plate. So you're going to take a perio probe and you're going to flap it back, and then you can hold your perio probe like this, and you know that you're going to have some sort of angulation going more straight up from the angle in. You're only going to go a few millimeters in as well, so you can measure that from the crest of the bone. So this gets you a very, very close measurement as to where you should be in space for a placement like this on the lower. Very straightforward case. It's right in front of your face when you're doing it. It's a great starter case for a molar implant. You've got 2 guiding teeth here to make sure you're going to be going directly in the middle there. Here's a little bit trickier because this is more of a collapsed space, but it's on the left side. Places on the left side, you tend to either tilt it too far mesial or too far distal. You tend to angle it like this, or you tend to angle it like this. Some people say you always mesial tilt it, but I go, no, that's not always true. The tendency is to mesial tilt when it's on the opposite side of the body than your respective comfort, right-handed or left-handed. And so you sometimes overcompensate. So I see a lot of people overcompensating. So here, follow the line angle as best you can on the premolar, and that's pretty much what you want to do. You don't want to have to follow this at all. Actually, this looks shaved off a little bit, must have had a crown there. And you might want to make sure that your burrs can go through that as well, because that's my burrs have a stopping point on them, and it might stop there. So let's look and see that implant real quick. So that one I put in here. Okay, so here is a short implant. This is trickier. Let's see why I put that in. This is a while ago. This is probably about 5 years ago. And let's try to find where that nerve is. This is where he's really missing a lot of bone. At least it's not very dense. So, okay, here we go. So here's the top of the nerve right here. And I'm going to put that line right about there. So we don't need that short of an implant, actually. I'm not really sure. Maybe I was having a discussion and we changed it. So your nerve height in this side is right about here. So maybe that's actually pretty close to what we should do. Your drill sequence is going to really put stress down into that bone area. So you can do a short implant like this safely, effectively with the drill sequence with your nerve right here. So if you want to do something longer, let's see what we have. We have a wide, a 6 millimeter by 7. Let's do a 6 by 8. And you don't have, you can still drill the 6 by 7, and if that's where the nerve is, right here, so the nerve is right here, you can drill with the 7 drills, but then screw in an 8. There's not a lot of density here, so you can compress that downward as well as around here. So the only trick is that you want to open up that crest so that you can get an implant in like this and thread it through. Now, how do you do that? Well, you got to find a really short, wide, fat burr to get that open, because the rest, you can drill a 4 millimeter osteotomy here, but you're going to need, if this is a 6, you're going to need at least a 5.5 or 5 3/4 opening at the top of this crestal part here, which is actually hard bone. So this is where ultrasonics could come in well, because you're only taking apart the crestal part here and open that osteotomy. The only problem there is that you don't have an exact way to make the osteotomy round. It's kind of a guesswork thing, or you soften up the bone. Or you have an ultra wide kit. I have an ultra wide kit that has 7 millimeter drills in it that are 7 by 8 or something, or 7 by 6 or something. So I can open up a 6 or 5 or whatever. I can have the flex in there. So it might be something interesting to look at 1 or 2 drills that just takes care of that crestal part of the bone, because the rest you don't really have to drill at all. You just do the initial one, because I guarantee if you put this implant in and you go below that crest, you can probably move it around in the bone itself. So make sure you don't put it in and lean on it, and now you have an angled implant in a position you don't want. And that's why I like implants that actually have mounts on them, because it helps eliminate that error. A lot of implants today don't have mounts on the implants, so you don't see how the trajectory of that implant actually really is. So getting an impression coping and actually screwing it in sometimes really helps. Once you have an implant screwing in, you can make sure that your alignment is actually correct. So those are some tips for the starters that would want to find like the ideal starter case, which this is. So appreciate you for joining. Like us on Facebook and subscribe to us on YouTube. And please watch some more videos and check out some of our live streams and some of our other things that we're doing. We're always doing something with implants and full mouth rehabilitation. So I appreciate it. Take care.